My name is Doris Quon, and I'm the medical director of the Hemophilia Treatment Center at the Orthopedic Institute for Children. And I'm joined today by Eric Mamos, who is one of my patients. So, Eric, can you please share your story about how you were diagnosed with hemophilia?
Sure. First, Doris, thank you for having me on. So I was born in 1976, and I have a brother who is 5 years older. So it was more about him being diagnosed with hemophilia. He was surprised. So when I started to come along, they kind of had a pretty good feeling. I think it was a 50-50 chance that I would be a hemophiliac. And I'm not sure if they did any testing or anything specific, but they were pretty confident that I was going to come out as a hemophiliac from day one.
So prior to David, your brother, there was no family history of hemophilia.
No, they tried to trace it on my mom's side and my dad's side, and they couldn't. I mean, her dad's side, and they could not find anybody else who was a hemophiliac.
Do you remember, or were you ever told how David was diagnosed? Was it bleeding with circumcision?
That's it. Exactly.
So that's actually
Yeah.
a fairly common way that patients with hemophilia are diagnosed. Circumcision occurs, there's no family history, and the patient develops excessive bleeding.
Right.
So
as Jews, I never asked my mom this, but I'm like, I wonder if the Mohel had quite a bit of a surprise there when he did his job, because I don't think it happened at a hospital setting. I'd have to go back and ask her.
Okay, so then were you circumcised?
In a hospital.
So
under very
they
tight
did it under
conditions.
control. Okay. So what were your symptoms as a child? So you were thought to have hemophilia.
Yeah.
They did the controlled circumcision in the hospital, but what symptoms did you go on to have that led to them being sure you had hemophilia?
So I don't know. Let me put it this way: my first memories of a bleed, it was my father used to do my shots at the time, which is strange to think about now, and he used to do infusions on my foot. The first pain I remember was pain in my hip. I used to have bleeds in my hip, and the reason I remember that is because the only way I get around the house is by crawling around the house. So it was a very distinct memory, because it's like, wait, why can't I walk all of a sudden? And there I am crawling around like I'm a Marine, on the floor of the kitchen. But I don't remember before that, like what was actually confirmed or not confirmed. I don't know if they had any specific testing they did, but they knew.
Do you recall any specific traumas or anything that actually put you in the hospital, a bad bleed that resulted in you going to the emergency room or having hospitalization?
A few. The most significant was when I was 12, but prior to that, I know that when I was visiting my family in Canada, I believe I took a bat to the head and ended up in the emergency room. Again, I don't have a recollection of it, but everybody said I scared the entire family, and it was a whole big ordeal. The accident later, when I went into the hospital, I was actually 13, not 12, and it was the summer between my 8th and 9th grade, and I had fallen off my bicycle, and I had hit my head on the pavement, and it was a big ordeal, and I believe the hospital I was taken to told my mom that I had about 10 minutes to live, so she remembers that part, and then I lived. So that was very, very traumatic, and I think to this day there's ramifications. I've had a few seizures in my life that they don't know why, but the best thing they could say is it's probably that.
So you had a head bleed after the biking accident.
Correct.
I remember you telling me about that before.
Yeah, it was very, very, very traumatic, and more for my family, because since I don't remember a lot of it. I remember waking up to a lot of screaming kids, because at the time it was 6 kids per room. It was crazy, but it was quite an ordeal.
So what symptoms do you now have in terms of your hemophilia and bleeding?
So I've had really 3 what we call, I guess, target joints in my life. My right elbow, which was a big problem because I insisted on playing basketball for most of my life as a child. My parents stopped me from playing football, but they couldn't stop me from playing basketball. I played basketball and paid the price later with my elbow being a problem, and then both my ankles have caused significant issues, and both are fused now. And then the surgery I had on my elbow allows me now to rotate my arm, but it still doesn't get straight. So, those are the prices I paid. But, it was always okay because I got them doing something I loved, which is playing sports.